Welcome to another episode of Ignite Health with Caribbean Surgery. I am Dr. Surendra Persaud, and today we will be discussing a very important topic, and that topic is high blood pressure. In the healthcare space, most healthcare practitioners refer to high blood pressure as hypertension. So, what is your blood pressure for starters, and then what is then high blood pressure? So this is an extremely important and dangerous condition. High blood pressure or hypertension is often referred to as the silent killer. And it is estimated that about 1 in 3 of us walking around are unaware that we have high blood pressure. So I want you to think of your workspace, your home environment, and look around and count the number of adults and understand that 1 in 3 of those persons have high blood pressure and may not be aware of it. This is such an important topic that ever so often the various organizations and associations around the world, such as the American Heart Association, various cardiology associations, get together and they publish what is called the most recent guidelines. And so in the year 2025, this year, those guidelines were updated. And the guidelines have actually gotten a lot stricter in who we diagnose, what are the ranges. And it has been a significant change, and it reflects the recognition that high blood pressure is a significant problem. Later, we will discuss cardiovascular disease, and what we will learn is that high blood pressure or hypertension is a leading contributor to cardiovascular disease. And when we discuss cardiovascular disease, there are certain risk factors that we can't change, but there are certain risk factors that are considered modifiable, meaning we can do things to modify them. And so if we can modify these risk factors, then we can obviously modify your risk of developing cardiovascular disease. Let's go all the way back a little bit and discuss some basic anatomy. So all of us are aware of where our heart is and what our heart does. Actually, for those of us who have ever had children, one of the most incredible things we do is when they do the first ultrasound and you hear the heartbeat, we all feel a tremendous sense of joy. And that sort of tells you about how important we place the heart in the human condition. So the heart is a muscle and a pump, and it is divided into 4 chambers. So blood has to get back to the heart, and then blood has to go away from the heart. And we have veins and we have arteries. And the easy way most of us remember it is A for artery, A for away. So any vessel that goes away from the heart is considered an artery. So when the heart squeezes, the heart is essentially a pump, and it is pushing this blood out of the heart into so that all of your organs can get oxygen, can get the nutrients that's being carried in the blood. So this pump, when it squeezes, is going to exert a pressure on the artery. And the artery is essentially these tubes. And the tubes have a wall, and they have a certain thickness, so they have a muscle. So all of us who have had a blood pressure taken will realize there's 2 numbers. There's a top number, which is usually larger than the bottom number. Why are there 2 numbers? Well, when the heart squeezes, that blood ejects, and it then presses against the walls of the blood vessel, which are going to stretch because they're receiving a pressure, right? And so that pressure that is exerted at the time the heart squeezes is called the systolic blood pressure, or the pressure that the heart is exerting as it ejects the blood. Now, the heart pauses and relaxes, and it has to fill. Now, we can't have no blood flow at that point in time. So how does the body maintain blood flow? So the blood vessel, because it has a muscle, will stretch, and then it will recoil, much like you pull a rubber band. So when it recoils, that gives us what is called the diastolic, or the bottom number. So ideally, you should take your blood pressure, and today, many times people will come and see the doctor and get their blood pressure checked. We have learned over the years, we actually give it a name. It's called white-collar hypertension, meaning most patients, when they see their doctor or have a white coat, they get anxious. So today, what has happened is we have changed that, and there is the concept of outpatient or ambulatory blood pressure monitoring. So when somebody comes to see a doctor, we take your blood pressure and it's high. We don't say you have high blood pressure. We say to you, please go home and check your blood pressure. Check it periodically, usually the same time, most likely twice a day, and write it down. Because in your home environment, when you're relaxed and it is the more accurate way of determining your blood pressure. So when you speak to your doctor or you're concerned, you can walk into almost any pharmacy today or online and purchase. Now, one of the things I need to caution persons about, blood pressure devices, the only ones that the associations and most physicians rely on are what's called blood pressure devices that actually have a physical cuff. So the way the blood pressure is, and you should be relaxed, you rest your hand down on a table. There are many pictures online of how you should do that, how you should relax before, and the cuff is applied. So remember, the artery is here, the heart is here pushing blood out into your arm. That blood pressure cuff will inflate and apply a pressure across your arm, and essentially the pressure will be such that it will actually occlude or stop the blood flow into your arm. And it has a device in there that can sense. Now, as the pressure of the cuff decreases, blood will start to flow. And as the blood starts to flow, that is when we know that now the heart is pushing with that pressure that exceeds the pressure from the cuff. So you'll get one answer, one number, and then when it continues to decrease, you'll get the second number. And so we only want you to use machines that have a blood pressure cuff that can inflate, not the others that are meant, like we see people wearing things on their watches or their rings. Those are not considered to be accurate because you can't compare them many times. In time they will be, but as of now, you need to have a blood pressure cuff with a cuff, sorry. Now, what is the normal blood pressure? So normal blood pressure is measured in what is called millimeters of mercury, right, of pressure. And the old machines actually had, if you've seen the old machines which the doctors had, they would actually have a pressure bar which had mercury. So normal blood pressure is 120 over 80. The 120 is the systolic number, and the 80 is the diastolic, or the 120 is the pressure when the heart is ejecting the blood. And the 80, the bottom number, the diastolic, is when the heart is relaxed and filling with blood and the artery recoils. Now, this pressure is felt throughout our body, from our brains to the heart itself, to kidneys, intestine, feet. And this is why high blood pressure is considered the silent killer, because it is quietly damaging our organs and we are not aware of it. Now, the first thing then is what causes high blood pressure. And regrettably, the vast majority of the time, over 90-something% of the time, we have not been able to identify a specific cause of high blood pressure. So there are risk factors that we consider modifiable to reduce the development of high blood pressure, and certain things we can't change. We can't change our genetic makeup. But there are certain things that we can do to reduce our risk of developing high blood pressure. Now, so we spoke about the normal blood pressure, 120 over 80. So in the most recent guideline, they have gotten a lot stricter. So anything that is above 120 to 129, we say that's elevated. If you go between 130 to 139, that's considered stage 1. And if you are above 140, or the bottom number is greater than 90, that's considered stage 2 hypertension. Now, elevated, your doctor is going to want to talk to you about how you modify your risk factors, but we begin to treat hypertension from stage 1 onwards, usually with medications. Now, over time, the classes, the different types of medications that are available for high blood pressure has increased significantly. Many patients, especially men, did not comply. They did not like to take the medications that were prescribed for high blood pressure because many of these medications, they had side effects that would interfere with sexual performance. So a lot of men chose not to take those medications. However, today we have a much broader variety of medications, and we would encourage you to speak to your doctor. Now, one of the things we speak about in healthcare is access to healthcare. And it's such a generic term. What is access or poor access to healthcare? And one of the things that you need to be able to have a conversation with your doctor is, can you afford the medications? Can you afford to see the clinic? Can you afford to have these things done? Because one of the great challenges with diseases such as hypertension and diabetes, they are chronic. So we put them in baskets called non-communicable chronic diseases. That means that this is a disease that will be with you over your lifetime. And you need to understand their cost. Now, many of these medications today are generics and not very expensive, but still a cost. And so you do not want your doctor to be under the impression that you're going to get these medications and you're going to take them. Because if the doctor gives you these medications and your blood pressure doesn't seem to be improving, the doctor may want to tweak or change or add medications where the reason the reason your blood pressure is not getting better is you're not able to afford it. You're not able to take the medicines. We have had instances where patients have to take a medicine 2 times a day, 3 times a day, but they can't afford it. So they try to stretch it and they take it once a day. That is not going to be as effective. Now we will get into a discussion about how dangerous high blood pressure is by discussing the various diseases, or specifically what we call the end organ damage that hypertension does. So imagine this blood flow under high pressure, and what is happening? When that blood is ejected out of your heart, it's hitting the walls of these blood vessels. And if the walls of these blood vessels get damaged, and various processes, so tobacco, various pollutants, and high blood pressure, diabetes, damages the wall of the blood vessel. We have learned now that when the blood vessel tries to repair itself, and it will repair itself, but it can't obviously be back to normal. And many times your doctors are talking to you about taking medicines to lower your cholesterol. So what are the most common conditions we have? Renal failure. We have all seen the government of Guyana, for example. Recently, the president spoke about expanding the number of dialysis facilities. If you look throughout the world, what we call end-stage renal disease. So this is the number 1 and number 2 leading causes of kidney failure are high blood pressure and diabetes, both modifiable conditions. Almost every country struggles to cover the cost of dialysis. For many patients, they struggle to cover the cost of dialysis. It alters your life. So kidney failure, what we call end-stage renal disease, a leading cause of this is high blood pressure. Now think of your heart as a pump. All of us in Guyana are experts on pumps and water pumps because we all have water pumps. And so we know if you have a hose coming off of a pump and you kink that hose, you're going to strain the pump. Well, the heart does a similar thing. If every time the heart has to eject, it has to go against a higher pressure, what is going to happen? The heart will stretch. The walls get thick, the heart gets large, and that gets heart failure. Or because the heart is now thicker, the muscle is thicker, and the blood vessel is coming in from one end, it can't reach the other end. So heart failure and heart attacks, or where we have myocardial infarctions, is another leading end result of high blood pressure. Stroke. So stroke, the fancy name for stroke is called a cerebrovascular accident. And there are 2 main causes of stroke. You actually have the blood vessel burst. And why would a blood vessel burst? So the blood vessel may have a process in its walls that causes a problem. But a very common cause is elevated blood pressure causing a burst. So that is called a hemorrhagic stroke. You have bled into the brain. Or you have what we call ischemic strokes. So there's damage to the blood vessels. As the blood vessel repairs itself, it leaves a plaque, right, as it is repairing. You know, whatever it's plastering there, but that's an unstable plaque. And so when there's a blood pressure, this plaque will flick off and travel up and block one of the blood vessels, and that's called an ischemic stroke. So sexual dysfunction. So one of the leading and sometimes one of the early symptoms we get from patients is, and most men won't speak to their doctors about this, but they're having problems and they're not able to perform, or they're not having erections as they used to. And we look at that as a marker of cardiovascular disease. Then take the number of patients who have issues with their legs. So the big diseases that we will summarize are, and this is the diseases that are caused by uncontrolled blood pressure: kidney failure, myocardial infarction or heart attacks and strokes, and then myocardial infarctions and heart failure, and then stroke. So an ischemic stroke, where there's a blood flow stops to a critical part of the brain, or a hemorrhagic stroke, where the blood vessel bursts. So again, please check your blood pressure and seek the guidance of your physician. Now, we talked now about the diagnosis. How do you do this? So again, purchase your own machine. Go into the pharmacy, buy the ones that you put, and start to take your blood pressure. Take your blood pressure twice a day. Pick a period in the morning when you're relaxed. Pick a period in the evening when you're relaxed. Take the blood pressure. You will get 3 numbers out of the machine. The top number and the bottom number we talked about. And the third number is your pulse. Just write it all down, bring it on a sheet of paper, and speak to your doctor. Now, what do you need to do to reduce your chances of the development or the progression of high blood pressure? We have learned over the years that sodium chloride, salt, common table salt, is a big risk factor. So diets that are high in salt. Now, this is not necessarily the salt you add in your regular cooking, but think of all of the foods that we buy, the chips, all of the things that are packaged, and look at the amount of salt. Almost everything we purchase today that's a packaged or processed food has a label on it. Look and see how much sodium is listed, especially, like I said, the chips, the tinned items. Salt was used as a preservative. It's still used as a preservative. So salt gets added to a lot of foods, and you need to be conscious about that. Today, in many of the seasonings, you will notice that seasonings, they are replacing sodium with potassium. Now, if you do not have an issue with your kidneys, and you need to check with your physician first about this, we would actually like you to increase your potassium intake. And there are foods that are out there, such as bananas, etc., that have high potassium. So what we would like you to do is look at the salt you're consuming and gradually reduce the sodium that you are consuming and increase the potassium. In Guyana, I always say, we have no excuse as a people, to not eat fruits and vegetables. You pass by the markets, there is fruits and vegetables. And yes, it is expensive, but look in your own garden. I have always said if my grandparents came back today, they would be very disappointed if many of us are buying bananas and mangoes, but that is the reality. So you need to consume more fruits and vegetables and plant-based proteins. All of us, our diets are very, very high in carbohydrates. That's our tradition. So from the bread, the rice, the roti, the cassava, the eddos, all of those are high carbohydrates. But we have got to understand that diets that are rich in carbohydrates are not necessarily the best options for us. And so again, look at your sodium intake, increase your potassium intake, calcium, magnesium, or the salts. Eat more fruits and vegetables. Increase your plant protein and increase your fiber. Now, so those are the dietary aspects that we need to look at. Now, what are the other things? Unfortunately, all of us are struggling with weight control. It is fair to say that as you look around today, there has been a significant increase in almost everyone's weight. We are all struggling, and there are multiple factors for that. Our children, we're always lamenting, our children are not as active. They don't go out and play as we used to as children. And we need to work on that. Everybody today, from the adults, from the grandparents, all the way down to the infants, have little tablets, and we're stuck to some electronic device. So if you go to the parks, you go to all of the seawall, you see a lot of people exercising. There has been an explosion in gyms. So we need to work on our weight, because weight, obesity, overweight is one of the modifiable risks in chronic diseases. And so you need to start. And please don't set goals. Just start doing something. And it must make you, You should feel comfortable, you should feel happy doing this. And the same thing as we speak about with your diet. Diets generally don't work. You need to change the manner in which you eat. Almost everything in life is a simple equation, right? Our body needs a certain amount of calories. We get those calories from the foods we consume and the beverages we drink. So calories come in a few versions. They'll come in the versions of carbohydrates, the sugary stuff, the starches. They'll come in the form of fats, right? The oils we cook in, the margarine, the butter, etc. And it'll come in proteins. Now, what we know is that in difficult economic times, proteins tend to be expensive. Vegetables tend to be expensive, so people tend to consume more carbohydrates. But remember, when you consume all of these, there's a certain calorie count. If you are consuming more calories in a day than your body needs, it is going to store that. That is how we are designed. And we are going to hold on to those calories, not as protein, but we're going to hold on to those calories as fat. And then when you're trying to diet, everybody laments, I am not losing this stubborn fat, because our bodies are not designed. You have to tweak your metabolism. And that's why we see people talk about intermittent fasting, various fasting, because we are essentially trying to get our body to think we are in a starvation mode. But when you have diets, when you do that, you're actually sometimes can make it worse, because your body is thinking, oh, this person doesn't have food. And whatever little morsel you eat, it will hold on to that. So speak to your physician, speak to your dietitian about how you make these changes. Now, coming back to the non-dietary issues, we've spoken about weight. You need to increase your physical activity, whether it's walking in your yard, whether it's walking down the road, whether it's walking in the park, whether it's going to the gym. You need to do that, because the other two components that are significant are poor sleep and stress. Now, every single individual has stress in their lives. What we all have is differences in our ability to cope with that stress. Now, what I say to many of my patients is, what is it that makes you happy? What is it you can do for 5, 10, 15 minutes where you can block out the planet and just be at peace with yourself? Is it making a cup of tea at 5 o'clock in the morning and going up and looking at the sun? Is it making that cup of tea and walking and looking at the flowers in your yard? Is it picking some vegetables off of is it watering your plants? Is it playing with your pet? Whatever it is that you can do for 10 to 15 minutes a day where you block out the planet and you're at peace with your soul. Sleep. Almost all of the patients, almost all of us are having terrible sleep. And there are a multitude of factors. There is evidence to suggest that all of us who spend the 30 minutes, 20 minutes, 1 hour before we go to sleep staring into some electronic device is possibly not a good idea. The light coming out of that is possibly not. You look into our rooms right now and we've got little blue lights and little green lights and little pink lights and little all over the place. We don't, when we sleep today compared to how our grandparents slept, there is so much light pollution. And so all of these things you need to ask yourselves, are you creating a proper environment for you to have a good night's sleep? Most people get up tired. Now, if you're not able to sleep properly, you're going to be stressed. Okay, so to summarize all of this, what are we talking about today? We are talking about high blood pressure, which is hypertension. The review states today that we have got to be a lot stricter in the diagnosis and who gets treated. So we encourage everyone to check their blood pressure. Who gets it? Everybody. The minute you hit adulthood, you should get your blood pressure checked. And you should do it on your own. Bring 2 weeks of these recordings to your physician. High blood pressure is the most preventable and the most common modifiable risk factor for cardiovascular disease, which is in Guyana and in many places. Cardiovascular disease is 1, 2, and 3 in terms of causes of deaths in the adult population. So high blood pressure is modifiable, meaning if you're developing it, we can advise you to do things that will slow down the progression. If you have high blood pressure, we have a wide variety of medications to treat your blood pressure. You're going to do most of this monitoring out of the office. If medications are not making you comfortable, if you're not tolerating the medications, speak to your doctor. Lifestyle changes. We talk about lifestyle changes, and every doctor and every healthcare practitioner will lament to you, but this, you have to do it. You have to get out and take a walk. You have to go out and get relaxed. You have to put down the devices. You have got to make your better food choices. We can't go and make those choices for you. And medications, like I've mentioned, the gamut of medications, the types of medications, we continue to increase it to. So in summation, please, what I would like everyone to do is go out and get a device, or go to a pharmacy, go to your doctor, get your blood pressure checked. And then, as mentioned, we do not diagnose you with high blood pressure on one reading. We want you to collect these readings over a period of time, bring it to your doctor. Your doctor will then decide, are you normal, are you elevated, are you stage 1, stage 2, and advise you as to what needs to be done. Lifestyle changes are important. And so on that note, thank you very, very much, and have a wonderful day.